Hello, my name is Dan Furcucci, and I'm with a company called UFirst Services, located in Buffalo, New York. And I'm excited to welcome you to this webinar regarding indoor air quality in healthcare. When it comes to ORs, ERs, and other healthcare settings, it's common practice to sterilize medical instruments, and it's equally vital to also sterilize the air. The air management portion of protecting a healthcare facility's occupants and users is often underestimated and undermanaged. Typically, we bring sterile instruments into the OR, remove them from the sterile pouches, and expose them to non-sterile air. Could this be the reason why we're seeing a rise in hospital-acquired infections? Air is continuously contaminated by airborne pathogens. The dissemination of pathogens in HVAC-associated transmission is widely known, given that numerous studies have shown that biological pathogens are capable of growing on filters, negatively affecting the quality of filtration. HEPA filtration is the gold standard for air purification in healthcare. The first obvious thing we need to realize with HEPA is that the system merely traps airborne pathogens instead of killing them. HEPA filters create a breeding ground for harmful contaminants, such as mold and bacteria that can grow on them. And it's well known that filters are not able to trap all the pathogens. HEPA filters need frequent replacement, resulting in high operating costs. When filters are replaced, it's recommended that the technician suit up to protect themselves. And how often does that happen? And is it possible for harmful pathogens to be reintroduced back into the air when the filters are replaced? The VA hospitals are of particular concern when it comes to indoor air quality because of the aging infrastructure. Maintaining the required air changes per hour may be compromised, in addition to inadequate maintenance of air purification systems to maintain continued efficiency and efficacy. This, of course, causes concern for hospital-acquired infections, especially among the elderly and the medically compromised patients. HEPA filtration must always be augmented because air treatment in healthcare facilities fall into two main categories: air filtration and air purification. Air filtration, of course, involves passing air through a system to capture the physical contaminants, versus air purification, on the other hand, breaks down the airborne contaminants by subjecting them to a biochemical process. In a healthcare setting, the air quality management strategy must include a combination of air filtration and air purification in a complementary manner, as part of an overall infection control management strategy. I'm excited to introduce you to SteriSpace, an air sterilization technology. SteriSpace has set a new standard for air sterilization. In fact, the term air sterilization never even existed up until now because it was not technically possible to sterilize air prior to SteriSpace. SteriSpace uses patented compressive heating to sterilize the air and free it from biological contaminants, including viruses, bacteria, and hardy spores. SteriSpace doesn't trap the pathogens, but actually kills them using patented compressive heating technology. This technology has been tested and validated extensively through funding by the U.S. Department of Defense, and has repeatedly demonstrated an effective kill rate of 99.9999%, achieving a sterility assurance level of 6 log reduction. Anything less than 6 log kill is not sterilization. SteriSpace is the only technology available on the market that actually sterilizes the air. There is no other that can make this claim. Biological pathogens commonly escape through HEPA filters, and it's not necessarily the smaller pathogens that get through. SteriSpace is not limited by the size or type of pathogens, because all pathogens are rendered inactive at temperatures of 464 degrees Fahrenheit with SteriSpace. As you can see, even the most effective filters are unable to sterilize the air. SteriSpace is scalable in size and can achieve a flow rate varying between 250 and 5,000 cubic feet per minute. The compressed air is treated uniformly, so there is no untreated air or leaks. By simply adding a chemical catalyst, the system also eliminates select exhaust pollutants, VOCs, and common industrial chemicals. SteriSpace does not require noxious, corrosive, or hazardous chemicals to destroy biological contaminants. It uses more of a natural, holistic process to sterilize the air, which doesn't have any toxic byproducts or cause any harm to the environment. SteriSpace can be installed as a standalone unit on the exterior ground to treat the air in a room, as illustrated on the left, or it can be integrated with an existing HVAC system on the rooftop, as illustrated on the right. The technology gives you flexibility in how it's deployed. For instance, you can configure it to create negative pressure in an isolation room of highly contagious patients to prevent ventilation-associated outbreaks and superspreading events. Or it can be configured to create positive pressure in a room containing immunocompromised patients, which protects them from pathogens in existing ambient air. As mentioned, SteriSpace technology has been tested and validated extensively through funding by the U.S. Department of Defense and has repeatedly demonstrated an effective kill rate of 99.9999%, also known as 6-log kill. Please contact us if you want to see the abstract for any of these studies. SteriSpace can be used for portable emergency shelters, both soft-sided and hard-sided. These shelters could be used for disaster relief or emergency command and control centers. We have worked with a company in the past to develop a patient isolation system that can be deployed where highly contagious patients need immediate isolation to prevent disease outbreak. You might be starting to see now why the U.S. Department of Defense has such a keen interest in this technology. SteriSpace was originally designed for biological and chemical defense, which it's able to achieve by sterilizing the air. SteriSpace technology is scalable. What you see here is a 5,000 CFM mobile unit. This system was developed in collaboration with the U.S. Army Corps of Engineers at Research Triangle Institute. The kill rate achieved was a staggering 99.99999%, otherwise referred to as a 7-log kill, which is unheard of. There are other technologies available for treating indoor air, such as bipolar ionization, which cleans the air inside buildings using an electronic charge to create a plasma field filled with ions, robbing them of their life-sustaining hydrogen particles. Unfortunately, there are major drawbacks with bipolar ionization, such as hazardous environmental effects. Ionizers generate potentially dangerous levels of ozone, which could be harmful to us and our environment. The long-term CO2 buildup negatively impacts cognitive abilities. And the efficacy is questionable and certainly cannot make the claim of air sterilization. UVC emits shortwave ultraviolet light to kill or inactivate microorganisms by destroying nucleic acid and disrupting their DNA so they can no longer perform their cellular functions. However, just like bipolar ionization, UVC lamps generate ozone, and some UVC lights also contain toxic mercury. UVC lamps lose their efficacy by 15% every 6 months to a year, so frequent replacement is required. Another drawback is that the system requires quote-unquote exposure time, which can be several minutes, and can only affect areas that the UV light shines directly on. So the shadow areas, for instance, are not treated. Microorganisms that pass through UV light with some velocity do not get enough exposure time to be affected. So here as well, the efficacy is questionable and certainly cannot make the claim of air sterilization. The healthcare industry's current level of air quality is ineffective against the threats of airborne pathogens. Nothing less than air sterilization should be acceptable for air quality. SteriSpace sets a new standard for air sterilization in healthcare to protect patients against these airborne pathogens that could cause hospital-acquired infections and disease outbreaks, as we have experienced with the current pandemic. SteriSpace gives you the best of both worlds, the highest level of efficacy available on the market, without the drawbacks or side effects of alternative technologies. Thank you for taking the time to watch this webinar. Please contact us so we can work together to make this world a better place.